Welcome to the American Hospital Association's Leading for Safety, a virtual series that features insights from past AHA Quest for Quality leaders and leaders in the field of patient safety on how healthcare leaders can drive safer, higher quality care by fostering a culture of safety and innovation. Combining the AHA's prestigious Quest for Quality prize with the Patient Safety Initiative, Leading for Safety provides strategies for executive leadership in advancing patient safety. I'm Dr. Mindy Estes, and today we have the privilege of speaking with Nancy Howell Agee, CEO of Carilion Clinic and the 2004 recipient of AHA's Distinguished Service Award, the organization's highest honor. Nancy's remarkable journey began as a nurse when her commitment to patient care laid the foundation for an extraordinary leadership career. Since becoming CEO in 2011, she has led Carilion Clinic's transformation into an innovative, integrated health system, serving more than 1 million people across Virginia and West Virginia. Under her leadership, Carilion has evolved into a patient-centered, physician-led organization that's setting new standards in healthcare delivery. Nancy's vision extends beyond traditional healthcare boundaries when she helped forge a partnership with Virginia Tech to create the Virginia Tech Carilion Clinic School of Medicine, which has now graduated more than 400 physicians. Her 20-year engagement with AHA includes serving as board chair in 2018, and she currently chairs the board of the Coalition to Strengthen America's Healthcare. Nancy, it's great to have you with us today to discuss insights on healthcare quality, safety, and leadership as we celebrate your Distinguished Service Award recognition.
Oh, Mindy, thank you so much. I'm honored to be here. I'm frankly a little humbled to be in your presence because of what a remarkable leader you are. And since I've known you, which maybe goes back at least 10 years, if not longer, you have been nothing but a champion for quality and patient safety and doing the right thing for every patient every time. So thank you very much for having me.
Well, it's a pleasure. And so let's just jump right in. You know, you've had a remarkable career from nurse to CEO and long service in the field for AHA and other organizations. And so I think it really gives you a unique perspective on healthcare quality, safety, equity, workforce, all facets that go into a quality organization. So thinking back, what have been the most important actions you've taken as a leader to drive quality and patient safety?
Well, I'm glad you mentioned that I began my career as a nurse, and I treasure the fact that I am a nurse still, and those one-on-one patient encounters are what have always driven me. The notion that you're caring for one person after another and how you do that the very best of all. As I became a leader in healthcare, about the time that I was moving as a chief operating officer and then the CEO, I was a representative from the American Hospital Association to the Joint Commission, and I was on the Joint Commission board. And at that time, we were beginning to talk about zero harm. And so I was hearing from the AHA in one ear, patient safety, quality, and in the other ear from the Joint Commission, patient safety and quality. So in stereo, what's really important? And I pondered that quite a lot as a leader to look at our own organization. What could we do differently? Not just check the box, not just meet the regulations, but really understand fundamentally what it meant to improve healthcare, improve patient safety, and improve quality. It seemed to me that it needed to start with the board. And so sort of a bottom-up, top-down conversation of education about our highest priority and what that meant. And when we talk about statistics, it's really important to measure quality, of course, but a statistic represents a patient. And so we began to frame how we think about quality with a patient in mind, not the patients, but a patient. And it seemed to make a difference. So with the board, at that time we reorganized the board and the board committees. And while we had a quality committee, it wasn't perhaps as robust as the finance committee. And it seemed like the committee that got the most airtime at board meetings was the finance committee. And educating the board about what it meant to be an integral, high integrity, zero harm organization, we spent a lot of time. And so we renamed the quality committee for the board CAPS, Clinical Advancement and Patient Safety. And now the two most important board committees are CAPS and Finance, and our board chair sits on both. And I think in hindsight, it was really important that our board chair began to own patient safety and quality as the single most important thing. And, I'm really proud of where we've come as an organization, but it took that board oversight and focus to make a difference. There are many other things too. Then, from a bottoms up standpoint, I'll tell you something else we've done, Mindy. We celebrate what we call the great catch. And so the more event reporting that we do, we think that's fantastic.
Mm-hmm.
And so any little thing, any big thing is funny. I was waiting on the elevator, a gurney went by and it went a little too fast around the curve. And there was a resident standing there and he said, "Hey, I think we need to put that in the event report." And it was, just kind of an everyday encounter, but it was a great focus. The other thing we did was create a new set of values. Our mission is to improve the health of the communities we serve. We focused on our values, and our values include courage, compassion, curiosity, commitment. And by focusing on those values, we use those to talk and to educate regularly for new employees, as well as every year the required education for all staff include focus on our values and what that means to patient safety and quality. And the last thing I'd mention is that we organized everything under one umbrella. So everything from risk management to quality reporting to all the sort of things we do for preparation for Joint Commission, for surveys from our state, patient safety, patient advocacy, and our human factors team and our sim lab are all under one umbrella. And creating that real focus that's both education, metrics, and celebrating the good work that we do.
It's remarkable. There are a couple of things that have struck me. One is your point about so much time spent in board meetings on finance. And one of the things that we did at St. Luke's was to reorder our board agenda and have a quality close, if you will, just like we have the financial close, where we are presenting the quality metrics not only on a monthly basis but year-to-date basis, so that we have time on the front end of the board meeting to talk about quality as opposed to whatever time we had left. The other thing I would mention is, as you know, I'm currently on the Joint Commission board, and we talk about innovation and quality and patient safety. And the conversations when you were on the board beginning to talk about do no harm. Today, Joint Commission is innovating and innovating rapidly. And we're talking about quality in its traditional sense, but we're talking about sustainability. We're talking about equity. We're talking about environmental impacts, and we're talking about technology. So I think it really is organizations and the Joint Commission in this instance marching together from a foundation that's been created over a number of years.
That's fantastic. It's music to my ears. And you're right. That's exactly what we do at our board meeting and at our senior management team meeting, our leadership meetings. We talk about quality first and finance second. And I think just that setting that priority, that quality and patient safety are critically important and our highest priority. And we always introduce it that way. No money, no mission, but without the mission, we don't need the money. So we try to pay real attention to that.
You helped develop Carilion's innovative care model. Undoubtedly, and I've heard you speak on how that evolved. And I know you have a lot of insights for other leaders. So if you were advising a new system leader, and there's certainly, as we've seen movement in healthcare, there are a lot of new system leaders in our field. What would you tell them to do first to set the tone for an effective culture in the organization? I think you've already touched on that, but I know there's more.
I think creating an environment of this is our highest priority means you're using every single meeting, every memo, your social media. We have an internal social activity. We focus on that with every single communication that we have. And I think that that's critically important. But I'm glad you mentioned technology because both existing technology and new technologies, again, we focus on why we're doing this for patient safety and how it improves quality. And by having that as our key priority, I think it begins to permeate the organization. Technology is important. If you ask me what doesn't work as well as you thought it would when you first started, I'll say introducing an electronic health record. I remember when we did that and we did a big bang approach all across the whole organization.
Mm-hmm.
And I remember these words probably came out of my mouth as much as anybody's. We're going to eliminate medication errors by having this technology. And of course, that's ridiculous in hindsight. There's nothing that can completely alter the human nature of our business, thank goodness. But because we are humans, mistakes can happen. And so doing everything you can to have a safe environment, to create a culture that's a permissive culture that encompasses patient safety and quality as everything that you do, I think that makes all the difference. Mindy, you and I go back a long time. We used to think about things like central line infections and catheter infections. And I don't know, it wasn't that we were cavalier about those things. I think we were just as concerned about patient safety and quality. We didn't recognize the whole milieu that it took to care for every single patient every time in the way that a patient should be cared for. And when I look back and I think about some of the things that we perhaps took for granted or didn't realize that we could change, and now I look where we are as an industry, our whole field has improved patient safety and culture. And I think there's even more that we can do.
To your point of change, and I think there are few positives that came from COVID, but one I think is that, organizations like ours, we test, we pilot, we retest, and, we want consensus. And if we don't like the first pilot, we do another one. And I think COVID taught us very quickly that, we can innovate and we can innovate quickly. And we can learn from that innovation. And if we fail, we need to fail quickly. And you touched on the electronic record. And my next question here was just going to be, what did you learn from something that wasn't as effective as you might have hoped?
Well, I'll just echo, first of all, that you're right. During COVID, we learned, and I hope we continue to learn that lesson, and that is innovate quickly.
Mm-hmm.
I think we can be accused of being way too slow and thinking through things,
Yeah.
which is important. We have a saying here, take risk without being reckless. After all, you are talking about a patient's life. The notion that we can innovate, that we can recognize a need and do something about that and take ownership at multiple levels. So I think one of the real lessons that began before COVID, but really came home during COVID, was the necessity for focusing on the resilience of our staff and all the things that we can do because, as a CEO, you and I are not really important to that patient interaction, that precious moment between a caregiver and a patient. And so all the things that we can do to support our staff so that they can give the kind of high quality, safe care that we would expect.
Resilience continues to be important. And I think in this day and age is something that we used to take for granted as well, that the mission and the privilege to do what we do would fuel internal resilience. And I think part of this whole patient safety, quality of our workforce and our workforce's experience as well, that resilience and how we take care of that has become increasingly important. One of my jobs here is to watch the clock a little bit, and we are towards the end of our time, but I wanted to spend just a moment on your experience with AHA. You've worked extensively with AHA in recent years, and you and I each had the opportunity to serve as chair of the AHA board and to serve the field. And through that work, I think we had opportunity to know more about the broad array of work done by AHA to help its members with safety and quality and regulatory compliance, innovation, and many other aspects of care, and really a full toolbox for helping our field. And I guess what I would like to ask you is, what advice would you give AHA members about what AHA can do to help them and members of their team to advance patient safety, quality, equity, to learn how to better work with boards? Because AHA focuses on all of those important aspects of what we do.
I'm so glad you brought that up. And I think, first of all, the most important thing I learned about the AHA is it's a member-driven organization.
Mhm.
And that says it all. So what are the member needs? That's what the AHA is there for. And certainly being on the board, we listened to what do the members need, what do the members want. And there's all sorts of ways to do that, from the regional policy boards to various committees to actually serving on the board. There's huge opportunity to let the AHA know what you need and then respond to that. And we can see time after time, whether it's patient safety or quality or equity, so many ways. I've been especially concerned about rural healthcare because we care for a large rural population here. And the AHA is right there, focusing on rural healthcare, advocating for our needs. All you have to do is go to the website. I used to laugh. I would spend a lot of time developing PowerPoint and thinking through what was I going to tell the board, what was I going to do this talk or that talk. It's all there on the AHA website. The resources are just astounding. The staff are so responsive. They're smart. They're savvy. They can put you in touch with people all across the country who've either done what you're thinking about doing or who will want to talk to you about what you're doing and share those opportunities. So the American Hospital Association, it's just been a pleasure for me. It's been really formative in my career and helped our organization as we've been on this quality journey, focus on patient safety, and been great advocates for the needs of hospitals and healthcare systems throughout our region.
I couldn't agree more. And I think, the depth of expertise, as you point out in the AHA, is tremendous. And I can think of no time that I've had a question, how big or how small, that they've not been able to, if not answer in great depth instantly, within about 3 hours, I had the answer. So I would encourage everyone to utilize those resources of the AHA. Our time is just about up, and Nancy, I want to thank you as always for your time, for your sharing your insights and experiences, and your journey from being a nurse to an award-winning CEO, and your successful transformation of Carilion Clinic. It really provides powerful lessons for all healthcare leaders at all levels. And your commitment to quality and safety, innovation, combined with your dedication to mentoring future leaders, especially women in healthcare, truly exemplifies exceptional leadership. And, we've seen through your examples how healthcare organizations can navigate while maintaining an unwavering focus on quality and safety. Because at the end of the day, that is what we do, to provide the highest quality patient care and safety to our patients first and foremost. Your emphasis on engagement, resilience, and partnerships also offers a roadmap for transformation. And I really think it's important for our listeners to realize that underlying all of the success you've had is the heart of a nurse.
Oh, thank you, Mindy.
So, to our listeners, we hope this conversation inspires you to reflect on your own approach to quality and safety leadership. Thank you for joining us. Stay safe and be well.